Welcome everybody to Kraft Chiropractic. I'm your host, Dr. Christina Kraft. Today we are going to be hosting the 4th episode of Turn the Power On with me, Dr. Christina, right here inside the waiting room using the neuro fusebox. So hopefully you have the ability to watch this as well as listen to this because it's going to be very informative about what chiropractic is. This is really going to be a chiropractic 101, how to turn the power on to your body's health, energy, and truly just turning the power on to your life's potential. Chiropractic has the ability to do that, folks. Okay, so this is all about really preaching today around finding yourself wherever you are today, wherever you are in the world. You need to find yourself a chiropractor. All children, all adults, finding themselves a great chiropractor to work with, to work on the structure of the body, to work with the posture of the body, which then directly affects the nervous system, which we're going to talk about today. How do you optimize your potential? How do you optimize the energy within your body and your frame and your mind and your energy? All those things are optimized through the release of tension on the nervous system. So when you, for instance, come into me and you are a migraine sufferer, you might notice, those of you that have come in to see me, if you're listening to this, I'm going to be checking full spine even down into your feet to release tension in the fascia of the foot, which relates back to the head. We are correcting subluxations of the entire cervical, neck, upper back, lumbar spine, pelvis, as well as into the foot or into the shoulder. And I even do some work into the head, face, and jaw that releases tension on that nervous system so that you can function better. Okay? Most people come to me in pain. Most people want more energy. Chiropractic is incredible for those two things, reducing pain and giving people back their energy. However, it is really important to know that all healing takes time. All unlocking and unwinding and unblocking of those old things that you have going on in your body, old injuries that have been stuck in your body for a long time. Once you start to work with the body, it's going to take time to heal. It's really important to know chiropractic works 100%, but we also have to encourage our patients to do the things, including water, rest, exercise, breath work, things like that. It's really important. Chiropractic truly is a lifestyle. I get super passionate about teaching chiropractic in my practice. People like, feel a couple adjustments, I feel great, I don't need to come back anymore. But then they find themselves worse if they don't stick with it. It's really a phenomenon that's true. I have found it for myself, included in my own chiropractic journey, in my own chiropractic lifestyle journey. It's definitely something that you want to stick with and work with your chiropractor on the best frequency and type of chiropractic care for you. I am a hands-on chiropractor. I utilize many different techniques in my practice. I have pediatrics and kids in my practice that don't get the same adjustments as the adults do. I have elderly patients that don't get the exact same adjustments as the younger folks do, okay? I check feet, ears, even into the nose and into the mouth in my practice. So it's really important to look at the structure of your posture. Your forward head carriage is really important for me to help correct, okay? The only way we can do that is through the chiropractic adjustment. When done appropriately and done specifically, we can help improve people's breathing. And that's another thing. I was telling some patients earlier today, that's exactly why you start to feel better. You are changing your posture, you're changing the way you're breathing through that nervous system, and it also immediately will help boost up your immune system, help your digestion, your mood, and your sleep. Who doesn't want more of that? Chiropractors all around the world for over 125 years have been turning the power on to people and babies. Now animals for me. So those of you that are listening that are animal chiropractors, that's exactly what you're doing every time that you produce that adjustment. When you find that subluxation and you correct that subluxation, you are allowing innate to do its job even better. Now, the neuro fusebox is behind me today. So I'm literally in my waiting room this morning. And what I'd like to be able to teach you real quickly in this kind of short workshop episode, this small version is here for me to kind of look at as well. It's important just to know there's a picture of the brain here, different sections of the spine, and all of the primary and secondary functions of this portion of the spine, tissues, organs, and glands of that portion of the spine, and the possible effects. We're going to talk about this chart today real briefly, and I'm going to tell you about what I see the most in my practice and why chiropractic works for so many people because of its effect on the nervous system. Okay, it's all about bringing it back to getting your body back into proper function, proper alignment, and taking pressure off of the nervous system. We use the word pressure, interference, subluxation is the big word in our office. Subluxation for chiropractors, truly, it's the area of concern. Subluxations are what is causing most people's health problems, okay? So vertebral subluxations, I love to read it right from the bottom of this chart here, and it's a small version here. This is really easy for so many of us to grasp. When tension and stress build up in an area of the spine, it creates interference and overloads the nerves or nerves nearby, creating what is known as subluxation, also known as vertebral subluxation. This subluxation acts similar to a blown fuse in your house. When a fuse blows in your home, certain areas or appliances may not function until that power is restored. Okay? Similarly, by finding and correcting any subluxations in your spine, specific chiropractic adjustments, that's very important, specific chiropractic adjustments by your chiropractor help restore power and function to those parts of the body. Hence, our mantra here at Kraft Chiropractic is turn the power on. Take pressure off the brainstem. This is what you're going to find. When we adjust the brainstem area, which is C1 and occiput, C2, C3, right up in that area. Okay, how do you know if you have that area? We find it through our examinations. We find it through the feelings and motion palpations with our hands. Chiropractors are really, really good at finding subluxations, and that's what they're trained to do. And truly, that's the only thing that we do. Yes, we give some nutritional support. Yes, we give you some guidance with your diets and different things like that, and what to do with pillows and beds and shoes and things like that. But the best thing that we do, the best gift that we can offer you and your family is the gift of the chiropractic adjustment to remove the subluxations, okay? Even if you can't see this whole chart, that's okay. Let's start at that brainstem area. The number one person that comes to my office with brainstem tension is the migraine. The migraine patient, they can't open their eyes, they're sensitive to light, they're sensitive to sound, they're sensitive, they have their head forward like this most of the time. All of that spinal cord pressure is pushed forward. Can't even open your eyes. That's how tight your spinal cord is. We have to get that head back. We have to get that head back over the shoulders, and we do that by releasing. In my office, we release the occiput and the atlas right up here. It's a pretty intense adjustment. For those of you that have had my chiropractic adjustments, they're pretty intense, okay? They're not painful, but they are intense, which means they take a lot of pressure off the nervous system and you feel better. You should feel better as soon as you get up off the table. That's what we are hoping for, okay? Let me tell you about chiropractic and how important it is for those of you that are listening that have any of the symptoms on this list that you need to find a chiropractor, and you need to find a chiropractor yesterday or today, and you need to stick with them or try a couple different chiropractors to get the results that you're looking for. All healing takes time. When I work with people in the upper cervical region, these are the people that come in with vision, balance, coordination, speech, immune system, digestive system. They have problems with their balance, vagus nerve issues, including digestion, immune deficiencies. They have terrible high blood pressure. That's these patients, okay? Pituitary gland, sinuses, inner ear, middle ear, chronic ear infections in the newborns and babies and young adults. Chronic sinuses infections and chronic ear infections in the adult. Okay, this is not just for little ones that we check. This is for the adults as well. Eye problems, including chronic twitching of the upper eyelid due to stress. That's also a problem in the brainstem that we can check and see that as well. Face, jaw, and teeth. I check almost everybody's TMJ. The primary TMJ release is done with also adjusting the atlas occiput. Again, I'm not going to get into all of my technique today, but it's super, super important to understand that if you have things like headaches and migraines, vertigo, dizziness, vision, hearing loss, TMJ, jaw pain, low energy, and fatigue. You want more energy? Get adjusted. You want to optimize your health? Get adjusted. It's not everything, but it's a huge part of your health wheel, everyone that's listening to this today. Difficult sleeping, epilepsy, and seizures. If you have epilepsy or seizures, you need to get adjusted. Find a great chiropractor that's going to help optimize your nervous system function by taking pressure off your brainstem. Some of the stuff doesn't get taught to you guys, okay, that are listening. The general community doesn't know what chiropractors are doing. They just think we're just for neck pain and back pain. People with epilepsy, people with cerebral palsy, people with seizure disorders, ADD, ADHD, sensory and spectrum, autism. We can help you. We can help you. We can help you. Chiropractors can help you, okay? Focus and memory issues. There can be also low back problems in somebody that has focus and memory issues, but it's primarily going on up here, folks. We need to clear that upper cervical spine. How do we clear that upper cervical spine? With specific chiropractic adjustments, and I choose to use my hands. Okay, there's specific ways that I use my hands to do that, okay? Balance and coordination issues, speech challenges, high blood pressure. Let's give you a couple examples. New patient recently comes in, high blood pressure, restless leg syndrome, dealing with some weight issues, dealing with some high cholesterol, on a lot of different medications. And I said the main reason he's here, the main reason you're here is because we have problems up here. Okay? We have to tell the patients what's going on with their structure. Forward head posture, not very good posture, roll forward, a lot of pressure to the base of the spine here. So we're doing adjustments here. We're helping lift and breathe better when we get that spine, pressure off that spine, okay? Immediately afterwards, breathing better, blood pressure is going down. We do pre and post adjustment blood pressure here. Immediately that blood pressure goes down naturally when you get adjusted. Specifically and appropriately adjusted, your blood pressure should go down, okay? Depression, reflux, GERD, colic and excessive crying in the newborn, torticollis and plagiocephalogy, ear and sinus infections, allergies and congestion. We kind of went through the whole list there. If that is you, there is so much that chiropractors can help you with, okay? First of all, you need to get pressure off of your spine within the neck, okay? Spinal cord within the neck. The brain is attached to the eyes. The eyes is attached to the brain. The brain is attached to the brainstem. If you don't have bright and alert eyes, you have brainstem pressure, and you need to get to a chiropractor and get adjusted. No matter how they get you adjusted, get checked, get adjusted. It's going to help you, okay? It's going to help you, okay? I'm going to bebop all over the place, but I wanted to really focus today and keep this video kind of short, but focus on the primary area in the upper cervical spine. So, tissues and organs and glands that this upper cervical spine and brainstem innervate. Okay, all the spine's nerves from this area innervate certain areas. We just talked about it a little bit. The vagus nerve is cranial nerve number 10. It's the longest, has branches to the heart and to the stomach. It is the nerve appropriate for our immune response, our heart rate, I think blood pressure too, our heart rate, as well as digestion. So immune system, digestive system, and your heart rate. It's really, really important, you guys. It's really, really important to keep your vagus nerve tone appropriately working. How do you do that? By taking pressure off the upper cervical spine. And there's a bunch of different checks as chiropractors do. We look at leg lengths, we look at range of motion, we feel the neck. There's different certain tests that we do to find out why or where to adjust you up here. Okay, same thing with your baby. Real gentle with the baby, a little bit more force with the adult and the young adult. Okay, to find these different things. Okay, it's super important to understand how brainstem tension is pretty much anybody that you see maybe on their devices all day long looking down like this. All of this looking forward and down, this forward head posture, you're going to have problems. You're going to develop discomforts, but you're also going to develop things like headaches and migraines, dizziness, vertigo, vision, hearing, jaw pain, low energy and fatigue. The list goes on and on. If we move down to this on this chart, and I know you can't see it all, but it's just, you can at least see the colors here. The next piece, the lower cervical spine, nerves to the shoulders, arms, and hands. So those of you that come in and you have hand numbness, or you have elbow pain, or you have something traveling down the arm, it's usually coming from the neck first. We always go back to root cause in chiropractic. We go back to that spine, clear that spine, and then also clear the shoulder, the humerus, the clavicle, the shoulder blade, the elbow, the radius ulna, and the wrist and the fingers. I am a sports chiropractor trained to work with the extremities. If your chiropractor that you're working with isn't looking at your hands, maybe it's time to find someone else. Not saying that they're doing anything wrong, but make sure that they're clearing what needs to be cleared. A stuck lunate, for instance, in the wrist here, can eliminate carpal tunnel syndrome, where you no longer have to have surgeries. I mean, at least you give it a try before going to surgery, right? Chiropractic should be something that you think of first when you're not feeling well, when you start to have the discomforts or sensations in the body that aren't working, or if you're finding that you're having new sensations in the body, try chiropractic. That's really what this is all about today. Chiropractic 101. When something doesn't feel quite right, try your chiropractor first, okay? There's obviously areas where we don't, we're not in an emergency room. If you have a fracture, go to the emergency room. But there's times where chiropractic can be just absolutely, miracles happen in chiropractors' offices every day, okay? This lower portion of the head, this upper, right between this part of our neck here needs to be adjusted. That's where your throat is. That's where your thyroid is. That's where the nerves to the arms, hands, and wrists, I said that already. Your vocal cords, your inner ear, tonsils, and throat are innervated by this area. So people that come into my practice with chronic stiff neck and shoulders, we're going to help you by adjusting the CT junction. It's an amazing, incredible adjustment that I do. We can do it face down, we can do it seated, we can do it face up. There's many different ways to produce that adjustment if necessary for you. It's, again, I am trained to find out what the best way to adjust you is, okay? When people have chronic subluxations in this purple zone, anxiety and stress, croup and cough, swollen tonsils and adenoids, especially in the kiddos. Okay, why are we swollen? We probably have some pressure built up in the nerves around that throat, that tonsil, adenoid, larynx area. Sore throats, allergies, congestion, headaches and migraines, again, pain, numbness, and tingling in the arms and hands. Okay, clear the spine, clear the extremity. Clear the spine first, clear the extremities if they need to be. Poor metabolism and weight control, speech challenges. So a lot of the throat stuff, okay? Makes sense. The thyroid sits right underneath here as well. Moving our way down, people that have problems with upper GI, respiratory, cardiac, upper back and shoulders, esophagus, upper GI, I said that already, lungs, bronchial, upper respiratory. Here's your asthma patients. Asthma patients will improve by getting adjustments to the first rib. I have an adjustment to the first rib. It's kind of intense, but it does really, really help. And then we also check T2 and T3. Those are yours. The nerves that come off this area, this green zone, they go to your upper lung region, your bronchial areas. So people that have chronic pneumonia, chronic bronchitis, chronic, upper respiratory infections, get adjusted and see if it can help you. You will probably have less frequent visits to the urgent care, and you will probably see, even in your child, less illness, less times away from school, less sickness, less bronchitis, less coughs, things like that. It's possible. I see it all the time, okay? Stiff neck and shoulders, that's probably the biggest one here, okay? Down to our major digestive center, here's our yellow. This is T4 to T7. Major digestive center, our detox and immunity center of our body. I also like to call this the solar plexus. This is our solar plexus zone. The major digestive center, this is the area where your gallbladder is given its function from the spine. So literally like T5, T6, give those nerves off that spine. If you have chronic subluxation here, you might develop gallbladder disease. It's possible, okay? Liver, stomach, pancreas, spleen, middle, shoulders, and back. I had a recent pancreatitis patient come into my office. She had her scans done, her CT scan done. She came into me with a lot of pain right where pancreas would be, but also it refers a little bit to the back in this zone, kind of right between the shoulder blades. So she was one of those patients where concurrent care with the medical doctors was amazing. She got her scans done, but she still got back and got into my office for adjustments, and she's doing so much better. So we got her through that little stint of pain pretty fast, okay? Gallbladder issues, jaundice, fever, immune deficiency, indigestion is a big one. So if you're chronically in indigestion after eating certain foods, burping, upset stomach, stomach acid might be another issue. So we have a couple of supplements to help you with that. However, chronic subluxations from T4 to T7, chronic misalignments or stuck forward or stuck backward vertebrae at this level can create a whole bunch of stomach problems. So get checked, get adjusted, and get adjusted regularly. Down to the orange zone, we call this our sacral plexus, close, it's behind the stomach. Stress response, this is where the adrenal glands sit. This is where a lot of people have problems. with pain too, but usually they're compensatory when we look at the overall structure of the spine. Bedwetting in kids, I usually will find some subluxations in this, the orange zone. What else can we find in this area? This is our reproductive area, small intestine, kidneys, adrenals, we said that already. Kidney problems, gas, pain, and bloating, bedwetting, chronic fatigue, so hyperactivity. This area is also where we want to help calm down, like a young child, for instance. If there's a chronic subluxation in this area, the nervous system sometimes could be overactive. And by doing a full adjustment and really focusing on any subluxations in this orange zone, those symptoms can get better. And I would have to say bedwetting is the number one reason why parents, at least in my practice, I'm trying to do a better job of educating parents. That's the number one thing that I educate parents on when they're here. We have those conversations. We have those conversations in a real professional manner to understand that it's maybe not normal to be bedwetting when we're 8, 9, 10 years old. And so, right? So it's important to get your child to a chiropractor to get that nervous system functioning better, and it can help. And I have some research studies by Heidi Havik that talk about bedwetting and chiropractic. It's pretty amazing. Those of you that are struggling with infertility, chiropractic can help. And I should say this, chiropractic can help anything. I also learned this at Animal Chiropractic School. How simple of a statement, and I knew this already. Chiropractic can help anything. I didn't say cure. I didn't say alleviate. It can help anything. And if you're struggling with your health, your mood, your energy, your stress, your sleep, your digestion, again, the word of the day is find your chiropractor and stick with them and fall in love with chiropractic like most of my patients have. Well, I would say all of my patients have, and myself included. Chiropractic is a lifestyle. Chiropractic comes with being educated how your body is meant to function well without a whole lot. Okay? Your innate potential, your body does heal itself. Your body heals itself when given the right nutrition, rest, tools, adjustments, things like that, sleep, okay? Down into this blue zone. This is probably the number one place where people come in and point to, doc, I got some pain down here, right? Well, the reason why it is easily painful is because it's loaded with nerves. Loaded with nerves. This is a huge area of the spine that then produces a response back to the brain. Pain is actually produced in the brain. Even though you have pain down below the belt line or pain in your back, it's produced through the spinal cord back to the brain. So basically also what chiropractors are doing, what we're doing is we're helping your body to kind of turn the volume down on those pain signals, okay? The reason why we have symptoms is that the body is going, hey, there's a threat of tissue damage here. Okay, there's a threat of tissue damage here. It's like what I like to explain. So let's say the person has low back discomfort. Okay, are they also having problems with constipation? Often, yes. Are they also having restless legs? Often, yes. Do they have knee aches, ankle pain, problems with weak ankles and arches? Often, yes. Many people have multiple things going on in this lower region when their back is out. And I don't like to think that the back is out per se, but there's definitely some inflammation and some alignment issues, yes. But they're very, very small. Millimeters is what we're talking about when it comes to correcting alignment, okay? Hamstring tightness. So today I had a patient who's a runner come in. We did some adjustments. We contacted sacral tuberous ligament. It's a technique called Logan Basic technique. We did some work there. I told her, don't stretch, don't ice, don't heat today. Go about your day. See me in a week. I want to see how she does without overstretching her tight hamstrings. The reason she has tight hamstrings is that she has subluxation in her lumbosacral pelvis. The tight hamstring is a compensation. So we don't want to overstretch compensations. I'll talk more about that. I will talk more about that. We don't want to overstretch and stretch and stretch and stretch tight muscles. We don't want to do that. They are compensatory. We want to kind of get the bones moving better that they're attached to and then ease into some of that stretching. It's way less than you need to be doing, some of you folks. I teach stretches 30 seconds. 30 seconds 3 times, but you don't need to do them all day long. Once a day, there's a couple stretches that I show patients. I used to teach more about stretching, and I've been finding out that that's not really the best way about improving injury. We actually need to do less is more. Less is more, less is more. We'll talk more about that, I'm sure, too, okay? The parasympathetic plexus lies down here, so when we have a patient that is really high strung, lots of migraine headaches or lots of headaches, stressed out, there's techniques that I use called SOT, sacral occipital technique, where we rest you on some blocks. And we also have a couple other techniques that I produce for you that help you calm down, which improves your breathing, helps you kind of get into a meditative state, and where you can literally just like reboot your nervous system so that you can sleep better that same night. You're going to move better, feel better that same day, but you should sleep better that same night. Same thing with the kiddos. Okay, when you come in and you bring your little one to me, if they've been struggling with a cold or something and been fussy, cutting teeth, ear infections, stuff like that, bring them in, let me check them, and let's get them sleeping better. That's where the healing comes in. That's where innate comes in when you're sleeping, okay? Lower pelvis and sacrum regions here, lots of sciatic problems that come into the office. Sciatica is a really common diagnosis I get from people that go into the urgent care. It's based on symptoms. However, a lot of the times it's just muscle inflammation around the piriformis is the reason why I find it. So again, I do my contact on the sacrotuberous ligament, some adjustments to the pelvis and sacrum very specifically. And these usually clear up pretty quickly. Now, if they're disc related, it does take more time. Disc involved sciatica is a lot tougher to heal. It takes time. It can take up to 12 months to heal a disc, if not longer. And some people don't have that much time. They end up going into surgery. And unfortunately, that's just what some people have to do. And there are times where I have to send people to the neurosurgeons as well, because I have given them the best that I can. And that's what we are here to do. Do the best that we can with what the body has given to us as well. And as chiropractors, we do the best that we can to help improve that structure. And it's ultimately up to you folks, the patients, to do the work that it takes to heal, including the things that like I have on my wall, my 8 essentials. They're actually Tommy John's 8 essentials, but believing in something greater than yourself. Number 2 is purpose. 3 is relationships. 4 is sleep and naps. 5, prayer, meditation, and breath work. 6 is natural light and sunlight. Super important now that we're getting out of winter and into spring. 7 is nourishment. That includes what you eat and put in your body and on your body. And number 8 is body movement. It's up to our patients. We have to educate our patients every day in chiropractic how you can take care of you even better. And as we empower you, we see you unleash. We see your innate potential, and it's amazing to watch my patients. When I tell them that they're going to sleep better and they come back and they said they slept the best they've slept in a long time, because I expect to see that change given by what we've done to the nervous system and through the spine and the structure, okay? Some things that happen in chiropractic are unpredictable, okay? Like sometimes we can maybe feel a little bit not so great before we start getting better again. That's kind of called what we call retracing. I have a beautiful retracing brochure here. All healing takes time. All healing takes time. And the frequency that I see my patients typically is like every 7 to 14 days. For those of you that are chronic, we see you every 7 to 14 days in my practice. Some people think that they have to go to the chiropractor 5 days a week. If you are seeing a chiropractor 5 days a week and you're not feeling any better, it's time to maybe consider finding another chiropractor to try, because that might be too much for your nervous system, and your body's kind of stuck in this fight, flight, freeze, or fawn stage. It doesn't really know what to do, or the technique is just not right for you. And that it's possible. I have been adjusted by oodles of chiropractors over the years, and I'm finding that different techniques work better for me than others. Different practitioners I get along with better than others, okay? So that's the piece. Find somebody that's super passionate. And I'm super passionate about chiropractic. I love it. And I believe that it takes a lot of skill to become a great chiropractor and to produce the adjustment with skill and art and craft, literally, haha. It takes a skill, it takes a craft, it takes patience, and it takes seeing a lot of patients like I have over the last almost 13 years and getting really, really good at adjusting is what makes a really great chiropractor, okay? So tension and stress built up in the spine creates this subluxation, and sometimes it's not anywhere near where you're hurting, you guys. So when I was down at Animal Chiropractic College, I was actually, I'm gonna step in front here. Lots of different people, chiropractors of all different ages, men, women, veterinarians of all different ages, men, women, and some of them there, the veterinarians had never been adjusted. And, they were standing like this, so I don't need to be adjusted, right? Posture is key. You might not have a lot of pain, but how's your digestion? How's your sleep? If you have chronic headaches and you don't think that you need adjusted, you need adjusted, okay? If you have had, I'm going to turn over the other side of this sheet here. This is not the one that's on the wall. This is another one. A balanced nervous system, you guys, looks and feels like this. High energy, mentally alert, few symptoms, excellent health, resistant to infections. I'm hardly ever ill. And I do have to say that that's the honest to God truth. Hardly ever ill, never need to go into urgent care, don't need to be on antibiotics for respiratory infections. Well, chiropractic and essential oils do that for me. Positive mental attitude, I like to think that I have that a lot of the time. Vibrant and active, okay? An exhausted nervous system looks like this, things like cancer. Exhausted nervous systems, things like cancer, rheumatoid arthritis, diabetes, multiple sclerosis, depression, chronic fatigue, fibromyalgia, ALS, which is Lou Gehrig's disease, or Epstein-Barr syndrome, okay, which I believe is mono. Exhausted nervous system, those are some big things. So even if you have things like diabetes, you should still have a chiropractor on your health team because they're going to optimize your nervous system function. Okay, if you have heart disease or if you have rheumatoid arthritis, you can benefit from chiropractic. Okay, there's so many different techniques, and every chiropractor that's out there, you guys, we are so different. When you go and learn a technique at a seminar and you mix it with the practitioner like myself, we make it our own, and we make it and we try to pull things out of our toolbox where appropriate. Especially for me in my practice lately, I have been trying to optimize people's brainstem function so that they're less headaches, migraines, and when we clear a cervical spine, the person's life will change. Okay, you're going to see things brighter, you're going to hear things better, you're going to smell things better, you're going to taste things better, you're going to sleep better. Hopefully we can get you out of a stint of depression. I've seen it all the time in my practice. Okay, if you want more energy, you need to optimize your nervous system and you need to get adjusted. All right, need to get adjusted. You need to get adjusted. The unbalanced nervous system falls in this category here. Now, I do have these as printouts in the office, but this is actually from a company called Neuro Infinity. I used to use this Neuro Infinity in my practice that I worked with Dr. Bruce Crabtree in Nebraska. And an under-aroused nervous system looks like this, you guys. Poor attention, impulsive, easily distracted, disorganized, depressed, lacking motivation, poor concentration, spaciness, constipation, low pain threshold. So like this hurts. Low pain threshold means you are easily hurting from just bumping into a counter or something like that. Low pain threshold. Difficulty to get up. Worrying, irritable, low energy. Over-aroused nervous system according to this. Okay, people are full of these symptoms all the time in my practice. Cold hands, cold feet, tight muscles, grinding teeth, anxiety. This one's probably more common than the under-aroused. Anxiety, heart palpitation, so racing heart, or feeling that flutter in the heart, or feeling like your heart skipping beats, that kind of stuff. Restless sleep, so waking up multiple times per night, not sleeping through the night, not being able to get to sleep, wanting to, sleep more and more. Poor expression of emotions, that's a big one. That's why essential oils are so powerful in my practice. Essential oils help us to express emotions. One that I particularly have been loving to use lately is called helichrysum. It works wonderful when I use it with the dogs and horses at the barns as well. It helps them to express to me what's going on with their body. There's a little bit more intuition involved with this one, but it really is helpful. Essential oils and adjustments can change your life, okay? Especially if you're holding on to old stuck emotions, they're gonna hold in your body as pain, okay? Poor immune system, racing mind, we're still in over-aroused, by the way. High blood pressure, huge, especially in my male patients. Get adjusted. Accelerated aging and irritable bowel. Down the middle, we have an unstable nervous system. This is what this looks like. This person comes in and they have migraines, they have headaches, they have or have had a seizure recently, they're sleepwalking, they're having hot flushes, PMS, food sensitivities, bedwetting in the kiddo, and maybe even in the adult, it's possible. But an unstable nervous system in a child is that disconnection between brain and body, bedwetting at night. It's not normal to be bedwetting at 9, 10, 11 years old, and I have a few of those patients, or I've had them over the years. And so get them into the chiropractor, see if it will help them. I bet it will. Eating disorders. So eating disorders includes like eating too much or not eating enough. Okay, an unstable nervous system doesn't really know what it needs, so it either will not eat or eat too much. Or, I don't know a lot about anorexia, but I do know that there's not a lot of eating going on with that particular food disorder. But another one is bulimia. So purging, eating and purging. Those are the types of things we're talking about in this unstable nervous system. Bipolar disorders. Okay, bipolar people, you can absolutely be helped with chiropractic. So give it a try. Mood swings, and the big one that I see, and I do know that a lot of my patients suffer from, are panic attacks. And panic attacks is an unstable nervous system. When we look at it real basic, it doesn't quite know. It's over-aroused, under-aroused, and there's a lot of anxiety going on. Okay, panic attacks can be very, very scary. So if you've ever had a panic attack, or if you've had one recently, I would love to be able to help you clear your nervous system and get your body functioning more stable. Okay, taking some pressure off your brainstem, clearing your spine, maybe using an essential oil to help you calm. And for panic attack type folks and high anxiety, I have a product called Adaptive. It's wonderful. It's an essential oil that you roll on, and it helps you to calm down. It's got lavender and wild orange. There's different things that are in it to help us calm down. Okay? So, Chiropractic 101. I always am educating my patients. If you've been to a chiropractor before and they have not shared with you a basic merit chart like this, okay, that's okay. But this is important. This is important for us to teach our patients how we can help you. Your structure matters. How you carry your head over your shoulders matters. This is not normal. This is going to create illness. This is going to create vibrant, strong body health, okay? Keeping our head over our shoulders. If you can't do that easily, you need to have your chiropractor do some work with you to help unlock and unleash that nervous system through those adjustments. And the number one adjustments that I do is up here. Check up from the neck up. I remember Dr. Mitch Malley in Davenport when I was working as an intern with him. My brother did too. Check up from the neck up. Okay, most people have problems in their cervical spine. And in my practice, it seems to be stiff neck and shoulders, but then they have a lot of these other problems. ADD, ADHD, focus, high blood pressure, anxiety, stress, depression, difficult sleep, low energy. Low energy, low energy, low energy. And then what happens when we have low energy? We go to caffeine, and then we stay up late. Okay, there's this vicious cycle. You need to get your spine checked. You need to get your nervous system checked. Okay? You need to take the pressure off of your spine that's creating all of this fight, flight, freeze, or fawning. Okay? There's other supplements that I can recommend too for my patients for detoxification, adrenal support, sleep support. Essential oils are so powerful at helping us move those emotions. So if you have pain in your body, you probably have a stuck emotion in your body as well. And I'm going to help guide people, kids too, with their parents' help as well, guide you into understanding the correlation. Anger is real big and holds heavy in our low back. Okay? Down here. If we have problems with grief, holds in the lungs and in the knees. If we have problems with fear, it ends up showing up through this chest area, hard time breathing, lots of inflammation, lots of lung problems, colds, chronic infections, cold hands and cold feet. That's fear. Okay? Everybody's different, but for the most part, people pattern. Okay? Anger, TMJ. Anybody that's struggling with anger that I sense, or if they're having a bunch of problems with TMJ, we're going to give you some help to help with that anger. Okay? I have an oil called Forgive for that one. That's really incredible. We just roll it right over the TMJ, right over the heart, and then you can also have that for yourself. You can get a bottle for yourself for home. Okay? But this is important to understand. Chiropractic is so much more than just I have a back pain, a neck pain, a headache. Those are symptoms, but what's the cause? The cause is subluxation. In chiropractic office, the only thing that we're correcting is subluxations to your spine and nervous system within that spinal column, as well as your extremities, which include everything from the shoulder down and from the hips down. And I check almost everybody's feet, you guys. Everybody's feet in my practice get adjusted because old injuries in those feet. Every one of us has had old ankle problems, old stuck foot problems. So I used to carry a lot of orthotics, and I don't anymore. We're just correcting feet. Let's correct the feet, let's correct the problem, and there's less need to have orthotics at all from anywhere. Okay? Improve that structure, structure and function. If you have proper structure, you will have proper function. You will have less illnesses, you will have better energy, you will sleep better, you will have a much better vibrant life if you stay well adjusted. Thanks again for tuning in to today's episode number 4 of Turn the Power On with Dr. Christina, which was all about Chiropractic 101. Hope you all have a great day, the rest of your day anyway. To find me at drchristinacraft.com. I see patients from Tuesday through Friday, 1 Saturday per month, and I also now see dogs and horses by appointment only on Mondays and Fridays. You can get on my animal chiropractic waiting list also at drchristinacraft.com, and as always, you can call 218-789-1811 to leave me a message and I'll get back to you. But if you want to, you can book a consult with me, which is even better. That gives us a whole 30 minutes or 15 minutes, depending on which one you choose, of time over the phone together. Either human or animal chiropractic. If you want more information, book that consult with me, drchristinacraft.com. All of my services are available for you there. Youth, I'm accepting new patients, youth and adult. And I'm also accepting new animals, dogs and horses specifically right now. I also have essential oil sessions, emotional aromatherapy sessions. I have guided meditation sessions, and I have soul blend sessions where you actually get to make your own little soul blend with essential oils. And if you're ever interested in supplementation, we also have consultations for that and times specifically just for that as well in my sessions at drchristinacraft.com. If you have a loved one or a family member who's struggling with their health, I would love to be able to help them. And if you're listening to this and you don't live in North Dakota or Minnesota, find your friend or family member a great chiropractor. And if you need help finding a great chiropractor, I would love to be able to help you. I can help you find a chiropractor in any state in the United States or Canada. I do have some friends up in Canada practicing as well. So please reach out, 218-789-1811, and again, find all the things. Learn more about me, shop my products, learn about my services at drchristinacraft.com. Y'all have a great day, and I will see you next week.